here to help us out if any technical assistance arises throughout the session. Thank you so much, Dominica. So let's jump right in. Prior to COVID-19, the ILO estimated that there were 2.1 billion people in need of care and warned of a looming care crisis if not properly addressed. The pandemic has accelerated this crisis, deepening pre-existing gender inequalities and norms around care, and putting an unprecedented stress in our already overburdened care systems. The economic downturn of this pandemic has had a disproportionate impact on women and caregivers, particularly those who are facing intersecting forms of discrimination based on class, race, caste, age, sexual orientation and gender identity, religion, migrant status, and physical ability. Despite this, we have not seen the mobilization or political will, policy attention, and resources that are urgently needed to address this crisis head-on. At the same time, support for programming on women's paid and unpaid care work has increased substantially in the past 5 to 7 years, alongside international interest in women's economic empowerment, or WE, the acronym more broadly. Yet care remains a neglected area of programming in WE. And of the relatively small share of WE programs that do address care work globally, most are focused on recognizing, redistributing, and reducing women's unpaid domestic work and childcare, which are extremely important issues and part of the gender transformative approach to care. However, other issues in this agenda require attention. This includes representing the rights of paid care workers, tackling unequal social norms, supporting care-sensitive transformations in public service infrastructure and social protection policies, and addressing the intersectional dynamics and power dynamics of paid and unpaid care work. This discussion will focus on standalone care programming as a way to scale up effective solutions, test new innovations, and how to build an evidence base around what works to address systemic issues around care. This conversation will outline what needs to be considered in a standalone approach and how to ensure gendered perspectives and economic policy making are taken, especially when it comes to care. Additionally, panelists will highlight examples of existing programs and policies and prompt conversation around what's needed to advocate for standalone resources and programming around care globally. So without further ado, let me introduce today's expert speakers. Rula Sigayer is the Strategic Program Coordinator at the International Domestic Workers Federation. Also joining us from the International Domestic Workers Federation is Adriana Paz, who is the Latin America Regional Coordinator at IDWF. Aptha Garg is a Senior Program Officer with Promundo and supports programmatic initiatives across the organization's thematic areas. Dr. Patricia Wakulo is an Associate Research Scientist at the African Population and Health Research Center in Nairobi and is the research lead on a project focusing on early childhood development centers through the International Development Research Center's GROW program. Dr. Kate Grantham is the founder of FemDev, a global development consulting firm passionate about feminist approaches to research, evaluation, and analysis. So we're going to start off our panel today with an excellent presentation from Dr. Grantham.
Thanks so much, Amra, for that. It's such a pleasure to be here speaking alongside such fantastic colleagues on an issue as fundamental to feminist economics as the care economy. So my presentation will share the results of a small landscaping study commissioned by Oxfam Canada and carried out by my organization FemDev earlier this year. So both Oxfam and FemDev are advocating for greater investment by donors in paid and unpaid care programming, adopting a feminist approach. To support this agenda, a better understanding was needed of what's been done in this space, what works well, where are the gaps, who are the major players, and where donors can add value. So this research provided a high-level overview of the care programming landscape to identify the amount of existing programming and evidence that there is to build on, key trends and programming gaps, and good feminist practices, approaches, and funding principles. Data collection and analysis for this study involved a desk review of online program information, as well as outreach to organizations and donors to fill any information gaps. It is limited to major programs of work, so projects, campaigns, initiatives that directly address women and girls' heavy and unequal responsibility for care in low and middle income countries since 2010. It's this focus on these standalone programs that Amber mentioned, directly addressing care work. So it does not include programs that only indirectly address care or that merely integrate a care component or activity to meet some other objective. It's not a review of care research, so while it does include some examples of projects involving excellent action research and evaluation, it excludes secondary analyses of existing evidence or policies or data on care. It also doesn't include national laws or policies related to care, such as government-supported parental leave, but it does include programs advocating for these crucial supports. And finally, this is not by any means an exhaustive list of all care programs, but we do feel it's an illustrative snapshot of the overall care programming landscape. So over 100 programs were assessed to determine whether they met the inclusion criteria for the study, and ultimately 40 programs involving over 100 organizations around the world were included in the review, and the research is current as of April 2021. So the review identified 10 key areas or themes with respect to paid and unpaid care programming: affordable and quality childcare provision, care in the private sector, care in fragile and humanitarian settings, care workers' rights and organizing, caring for the elderly, ill, and disabled, energy and time-saving technologies, engaging men and boys in care work, measuring care work, gender or care-responsive public services, infrastructure and social protection, and social norms and women's agency. So this figure shows the distribution of care programs reviewed across each of these 10 key areas. As I mentioned, there were 40 in total. So note that these areas are not mutually exclusive. In fact, over 1/3 of programs, or 35%, focused on more than one key area. So I want to speak now quickly about the top 5 most common program areas identified by the review. So 35% of programs, the largest number of all of the different areas, were focused on providing quality and affordable childcare. 27.5% were focused on measuring care work, most often the use of time use surveys to look at women's unpaid care and domestic work. The same number are focused on tackling unequal social norms and promoting women's agency, so addressing some of these root causes around the unequal distribution of care. 22.5% are focused on engaging men and boys as equal partners in care work. And 20%, or 1 in 5, are focused on providing energy and time-saving technology to reduce the burden of household care tasks. Now, each of these areas are important, and they're part of a feminist approach to care. And despite their predominance in this review, none of them receive adequate attention and funding from donors today. So as Amber mentioned, care work remains a neglected area of programming on women's economic empowerment. It receives less than half of the financial investment from DAC donor countries compared to other WE program areas, most notably programs supporting women's economic opportunities and access. And this is according to a report released by Oxfam in 2019. So again, each of these areas are themselves important and under-resourced. But other areas also require attention under a feminist care agenda, and I'm going to turn my attention to those now. So here are what we call the neglected areas, or some key gaps in care programming that were identified by the review. And I'm going to speak about each of them in turn. So starting with support for care workers' rights and organizing. This is really a core part of a feminist care agenda. And this can mean addressing the inclusion of care workers' rights in labor standards legislation, promoting women's collective organizing for decent work in the care economy. And with the growing demand for care globally, this sector is also a really key source for future job growth. But despite this, programs supporting care workers' rights and organizing continue to be marginalized compared to those addressing unpaid care work, and they constitute just 12.5% of programs in the review. Now, under a feminist approach, programs in this area must be led by care workers themselves or involve meaningful partnerships with care workers' unions, organizations, and groups. Just 10% of programs included in the review are focused on the role and responsibility of the private sector in care provision. However, the private sector provides about 90% of jobs in low and middle income countries and is therefore really well positioned to be a key partner in addressing global care challenges. Programs in this area are typically focused on promoting employer-supported childcare or family-friendly workplace policies, such as parental leave, flex hours, or breastfeeding rooms. Unfortunately, however, most marginalized women and workers in the informal sector and in global supply chains seldom have access to these benefits from employers. Governments also have a crucial role to play in supporting a feminist care agenda. However, just 7.5% of programs in the review advocate or support state investment in care-responsive public services, infrastructure, and social protection. So public utilities and services like piped water, electricity, transportation are necessary to reduce the burden of household care and domestic work. And publicly funded childcare services and inclusive parental leave policies can also help to promote an understanding of care as a collective social responsibility rather than being women's responsibility alone. Another gap in the landscape is programs addressing the dynamics of care in fragile and humanitarian settings. So this could include in the aftermath of natural disasters or in the context of forced migration and displacement. The frequency of these types of events is increasing due to, among other things, but mostly climate change. So this issue we know is only going to become more urgent. However, just two programs or 5% that we identified in the review include a focus on addressing care in fragile and humanitarian settings. Finally, providing quality and affordable care for the elderly, the ill, and the disabled is a growing challenge, especially in rapidly aging populations throughout Asia. Women and girls shoulder a disproportionate responsibility to provide care for these groups, especially for family members. And solutions to promote more gender equitable caregiving need to be explored. Transformations in infrastructure also have a really key role to play because these can support individuals with limited mobility by providing better, more accessible transportation and city planning, thereby enhancing their autonomy, but at the same time reducing the demands on those who care for them. So once again, there is massive potential in terms of job creation for paid caregivers in this sector, provided that these jobs are regulated and that they provide decent pay and working conditions. Despite its growing importance globally, just one program identified in the review addresses care for the elderly, the ill, and the disabled. So we looked at several other aspects of the care program landscape, not all of which we have time for today, but this figure just shows the distribution of care programs by type. So this includes research and evaluation, delivery, and policy and advocacy. So 2/3 of programs reviewed include a research or evaluation component. And this is fantastic because this speaks to the large volume of evidence on care that is already available for us to build on in developing and designing programs. However, a feminist approach to care needs to be politically oriented. It needs to be action oriented. It has to go beyond this research and evaluation component to deliver much needed programs, services, and resources directly to communities and to advocate for social and policy change. So with that, I just want to end with a call for donors to adopt a feminist approach to investments in the care economy. So this to us means adopting a holistic view, including the different areas of work on paid and unpaid care, addressing the root causes of gender, social, and economic inequality with respect to care, adopting an intersectional approach to programming, including a focus on the most marginalized women and workers, such as those in the informal sector, and developing programs collaboratively through partnerships with local women's rights organizations, groups, networks, and unions. So my fellow panelists are going to be able to speak to what this approach actually looks like in practice. And they're going to be able to give some examples of innovative work being done by their organizations in this space. But hopefully this presentation just helped to set the context a little bit for what we're speaking about when we're talking about care programming in all its different forms. Thank you.
Thanks so much, Kate, for that excellent presentation and setting us up for a conversation with so much information and insight to think about. So I'm going to dive straight in and pose the first question to our panelists. And this one is for Rula at the International Domestic Workers Federation. So Rula, paid care work and the right of paid care workers is an area of the care economy that is often overlooked in research, advocacy, and programming on care, as Kate's presentation mentioned. From your experiences, can you share some reflections on the that contributes to the inequities and challenges of paid care work, such as those faced by domestic workers, early childhood care and education professionals, or long-term care workers?
Thank you, Amar. Sure. So first, the Federation, so the International Domestic Workers Federation represents, as of April, 590,000 domestic workers around the world who are organized within unions, collectives, or cooperatives. And this is the population that we are accountable to and from whom we get our knowledge. And I will try to respond to your question starting from a point in history that is really far back. It's the moment of the rise of private property and its intertwinement with the control over women's bodies. So recognizing that moment in history of the rise of patriarchy hand in hand with the rise of capitalism makes us understand the care and domestic work sector as a sector that is central to our liberation from the capitalist contradictions that produced this pandemic and continue to produce various forms of oppressions as we speak of. And as you said also in your introduction, we need to re-examine the unpaid and paid work continuum. It requires our attention, and insofar we legitimize and recognize one profession and discount another when it comes to care work. A historical example of that, nurses, they carry the history of witches, those women who created potions, now known as medicine, or those women who practiced magic, now known as medical procedure. They have done all of this, but the legitimization of their sector, the medical sector, only came with making it a man's job. And today we see similar legitimization based on levels of specialization or levels of education and access within the care and domestic work sectors. So instead of delving into the divide and conquer differences that we experience in this sector and that dictate our precarity, we need to be putting or directing our gaze towards the economic conditions that govern it, that create this precarity. And these are conventional economics. We really require a lot of feminist economic theory to be produced today and to dictate new norms that would transform gender norms, because conventional economics falsely teach us that domestic and care work are not productive activity. This is not innocent. Their contribution in countries' economies ranges anywhere from 20 to 60% of countries' GDP, but it's invisible. And if domestic workers were paid even the minimum wage, if not a living wage, it would be much, much higher. States continue to underserve this infrastructure of public services, and their economies benefit off of care workers. With the current policy, care workers are a band-aid solution to the weakness in the balance of payments. About 5 to 7 trillion US dollars of annual investment across sectors and industries would be required for reaching a sustainable development goal by 2030. But this language of developmental organizing would not be possible for gender responsive services if we do not address financing, if we do not address what it would look like to implement a progressive taxation system that would be key for decreasing inequalities, whereby wealthier people or institutions or employers would pay the larger share of taxes and adjust the disparities within the sector. International finance institutions as well must commit to a human rights framework, something that they have not done insofar. And they must be accountable for the forced austerity measures in countries of the global south, where many care laborers come from. And if they do not come from there, even when we look at the international dynamic within the global care chain, this chain affects one another. So even if these austerity measures are not necessarily happening in countries of the global north, it would inevitably feed into the weakening of care institutions in those contexts. So these economic adjustments deepen debt and remove subsidies, which in turn influences the care sector. And It comes paired with a political democratization rhetoric that an open market signifies an open environment and more leverage on rights. However, it plays out toward more displacement of the poor or the global poor because it does not safeguard the economic interests of workers. Rather, it safeguards the economic interests of the accumulation of capital through the devaluation of local currency, controls on recruitments and salaries in the state sector, privatization of state enterprises, increase of cost for health, education, the other services you have mentioned, and the phased removal of protectionist trade restrictions. These macro trends displace the care workers who must have social protection in three different forms. When we think of social protection, we think of the assistance, which should be available for everybody on a given territory without any contribution, and social security, which should be a tripartite measure of contributing towards one's security or insurance into the future, and social services, which rely greatly on institutional care, which is often privatized. This means that to adjust or to have a recovery from the pandemic or to have a gender responsive programming in care, we must have adequate financement. We must commit to having the IFI be accountable towards the impact that they have on the economies of the countries that we are addressing. And we must centralize labor rights and the voices of the workers of care economy, formal and informal. So a vision of justice would valorize care work and serves for a recovery that would transcend the individual human. When we say human-centric recovery, we mean healing the ecosystem as a whole that understands that our survival in it is collective. Thank you.
Thank you, Rula, for that amazing answer. And my next question is for Adriana. So building off of Rula's framing, what is your vision of a feminist caring economy? And how do the frameworks that Rula spoke to look on the ground, given the different realities of workers and organizations and policy structures that are navigated in this diverse global context?
Thank you, Amar. I'm going to switch to Spanish. So I'm going to remind everyone to put your interpretation, and I'm going to do so now. Bueno, muchas gracias, Amar, y a las organizadoras del panel. En primer lugar, quiero reconocer la presencia de nuestras líderes trabajadoras del hogar de América Latina. Aquí tenemos a Carmen Brites, es la vicepresidenta de la Federación Internacional de Trabajadoras del Hogar. Gracias, Carmen. Tenemos también la presencia de Andrea Morales. Ella es la representante de América Latina en el Comité Ejecutivo Mundial de la FIT. Tenemos también a mi compañera de equipo, Fernanda Valiente, de América Latina, oficial de programas. Tenemos a Sofía Treviño, parte fundamental de la FIT, América Latina, y de WIGO también. Somos un equipo y hacemos todo este trabajo realmente en conjunto, y por supuesto a Rula también. Bueno, con la introducción de Rula nos queda muy claro que el trabajo doméstico, el trabajo del cuidado, es uno de los trabajos más invisibilizados. ¿Cómo esto se ve en campo? En primer lugar, decir que desde el punto de vista de cómo las trabajadoras del hogar, las trabajadoras de la economía del cuidado articulan esta visión feminista del cuidado, es en primer lugar decir que el trabajo del hogar, el trabajo del cuidado es trabajo. Esto parece muy obvio y muy simple, que nadie lo cuestiona, al menos entre las personas que estamos en este panel. Sin embargo, en la práctica, en la normativa, en la legislación, en los estereotipos sociales y culturales, el trabajo del hogar ha sido considerado como no trabajo por cientos de años. Esta articulación nace desde una articulación de derechos y de sujetos de derechos elaborado por las mismas trabajadoras del hogar. En América Latina tenemos los sindicatos de trabajadoras del hogar que van de 100 años atrás, es decir, que hace 100 años atrás las compañeras trabajadoras del hogar comenzaron a articular que el trabajo del hogar es trabajo y que las personas que realizan este trabajo son trabajadoras, no son miembros de la familia, no son la persona que ayuda en la casa y no son la persona que le hacen un favor de tenerla en la casa, que le dan comida, que le dan ropa para que haga este trabajo. Esta articulación de derechos es revolucionaria y comienza a desafiar al movimiento laboral existente y al movimiento feminista existente. Comienzan ellas a decir, nosotros somos trabajadoras, por tanto, merecemos estar en las estructuras sindicales y merecemos estar protegidas e incluidas en los códigos laborales y en la legislación. Y al movimiento feminista decirle que la liberación de la mujer no puede concebirse si es que la liberación de las mujeres que están en la base de la pirámide no está tomada en cuenta. No es casualidad que la mayor parte de las trabajadoras del hogar en el mundo son mujeres negras, son mujeres indígenas, son mujeres migrantes, son mujeres que son las más pobres de las más pobres. Esto no es casual, esto fue construido. Esto fue construido económicamente, es decir, que la lucha de las trabajadoras del hogar nada más y nada menos confronta, desafía el desmantelamiento del patriarcado y del racismo y de las estructuras coloniales que viven no solamente en las estructuras legislativas, pero también en la práctica, en las interrelaciones entre las trabajadoras y las empleadoras. ¿Quiénes son empleadores o empleadoras de trabajadoras del hogar? Es la sociedad entera, ¿no? Incluso son los dirigentes sindicales, incluso son las feministas. Entonces, esta interpelación honesta es la que nos hace mirarnos profundamente como humanidad y ponernos al lado de las trabajadoras del hogar y reconocer la premisa que ellas dicen. El trabajo del hogar es el trabajo que hace posible todos los demás trabajos. Es el trabajo que hace posible las economías y el sostenimiento y la reproducción de la sociedad. Esta lucha ha sido una lucha de 100 años. Tenemos en América Latina una gran cantidad de sindicatos y de organizaciones de base de trabajadoras del hogar que les ha costado mucho. Les ha costado muchísimo y aún así vemos que los índices de sindicalización en el mundo son muy bajos, son del 1 a 2%. Existen 77 millones de trabajadoras del hogar, sin embargo la sindicalización es muy baja. Y esto por muchas razones, ¿no? Marcos legales que restringen y prohíben la sindicalización de las trabajadoras del hogar, la dificultad en organizar a una mano de obra laboral que se encuentra atomizada y que trabaja bajo puertas cerradas y bajo muros. Entonces, existen muchos elementos estructurales que hacen difícil la sindicalización, más no imposible. Y creo que la creación y la existencia de una Federación Internacional de Trabajadoras del Hogar prueba al mundo entero que las trabajadoras del hogar han hecho posible lo que se les decía que era imposible. Cuando yo hablo y organizo con mis compañeras, ellas me dicen, nosotras hemos crecido con un no. Y aquí parafraseo a nuestra vicepresidenta. A nosotras siempre nos han dicho que no se puede nada, que no se nos pueden dar derechos, que no se nos puede incluir en las protecciones, pero nosotras seguimos insistiendo en que eso es posible. Y esta es la lucha que ellas han logrado al cambiar marcos legales y al cambiar percepciones. Estamos en la mitad de la lucha y puedo seguir hablando de esto en la siguiente pregunta porque creo que mi tiempo ya se acabó. Muchas gracias.
Thank you, Adriana, and yes, please do continue later.
Muchas gracias, Adriana, y por supuesto vas a poder continuar luego. La próxima pregunta es para Abda. Abda. Hacer partícipes a los hombres y a los niños en el trabajo de cuidado ha sido clave para redistribuir estas tasas. Entonces, ¿cómo podemos hacer para que esto se relacione con lo programático? Muchas gracias por esa pregunta. Y con las presentaciones de mi otras panelistas, me parece que han sido grandes respuestas para esta conversación. Quiero comenzar diciendo que en cuanto a hacer partícipes a los hombres y a los niños, la razón por la que trabajamos con la redistribución entre hombres y mujeres dentro del hogar tiene que ver con las barreras que tienen las mujeres para empoderarse, que vienen como resultado de la carga que tienen las mujeres. Las mujeres pasan muchísimo más tiempo trabajando en el hogar y eso no les permite participar en la fuerza laboral con todo el potencial que tienen. Pero cuando hablamos
Formative methodologies or approaches to redistribution of care work and really kind of achieving equality of the distribution of care work, it's not enough to just focus on those individual relational programmatic interventions and campaigns, but really going beyond that. And we will really see progress when we can have these interventions linked to and in tangent with a holistic approach that's connected to community policies, community interventions, and policy changes on the institutional levels. For a long time, many have considered these interventions as singular or separate from one another to be done in a narrow, focused way. So you have interventions that work on group education with fathers or with individuals around care work. You have social norms campaigns, or you have policy advocacy. But when they're focused or separated from one another, the impacts that they can have can be limited. So, for instance, an example of that is that research by Promundo in the Republic of Georgia, we've noticed that we studied and evaluated a campaign around equitable fatherhood, and the campaign itself across time did see positive attitudinal changes around gender roles and around favorability for our parental leave. But what you saw less of was around behavioral changes. So the actual distribution of care work in the household, as well as other kind of men taking on more care work or taking leave. So what we're seeing is, changes and shifts in attitudinal understandings around care work and around the importance of care work. But we need to push forward those nudges around behavioral shifts and actually taking on that work and seeing that done in practice. So we need to start situating a lot of these interventions within a socio-ecological framework that is combining individual interventions with community campaigns, policy changes, advocacy, all working together in tangent with one another, and working in communication with one another. Promundo's State of the World's Fathers, it's a biennial report that we release around caregiving and fatherhood, and really is a research companion that kind of seeks to understand men's contribution to the uptake and the distribution of care work, as well as advocating for that. And it's really tried to outline what are the keys to unlocking care equality and the value of care work. And our research has found that if you are not looking at all levels, so that's the individual, the relational, the community, at a societal level, the impacts will not be sustainable in the long term. So we know that many governments work to extend parental leave for fathers, including a lot of the Nordic and Scandinavian countries. You also have the extension of parental leave in many communities and municipalities. But we know that not many men take leave, and when they do, it's only a portion of the time that's allocated to them. Meanwhile, we also know through our research that men do and want to spend more time with their children and would be willing to work less if men spending more time with their children and caring for their children. But they fear the consequences if they do so. So that includes financial consequences of losing out on opportunities or financial opportunities, or long-term career consequences for it. So many of those consequences that women have traditionally faced as a result of care work and the care burden, men are afraid that they too will be the recipients of those consequences. So there has to be more done in conjunction with one another in order to be able to really push the dial around care work. In the most recent edition of State of the World's Fathers, we really focus on 7 key actions, really focused around structural actions, but also that trickle down to the individual level to be able to achieve transformational change. And those include national care policies to promote the reduction, redistribution, and remuneration of care work. So a prime example, a best practice model, is the national care system that currently in Uruguay that works around centralizing care as a valuable component, and then working from a state level to be able to address that. Paid parental leave, which promotes the uptake of care at a critical age for child development and for women's economic empowerment. The amplification of social protection programs to be more inclusive and really work around caregiving and the care distribution. Transformation of our institutions, such as health institutions, to address reinforced biases. promoting an ethic of male care given from an early age. So that's including young boys and adolescents in this, in being able to understand the value and take on care. Changing workplace conditions to promote decent work and support for caregivers. And then finally, but not least, accountability by politicians, but specifically male politicians, to take on and champion these causes. You see so much advocacy and movement around women's rights activists, women-led organization, women politicians. But this isn't just a women's issue. It's really about the economies as a whole and our society as a whole. As my fellow co-panelists have mentioned, the impacts on the GDP. So this really needs to be taken about as a whole of community level issue. I'll stop there.
Thank you so much, Apta. Next question is for Patricia. So Patricia, we've heard a lot about the barriers and challenges for addressing paid and unpaid care in different contexts. Oh, sorry, Patricia, that is the wrong question. You will be given that afterwards. So Patricia, this is your question. How and why do you think that paid childcare, especially for women in the informal economy, is often neglected in discussion about care by policymakers, academics, and funding agency? How can this issue be brought out of the shadows, and what can we do about it?
Thanks, Amar. We see that paid childcare, and my fellow panelists have already mentioned this, paid childcare has been pushed to the periphery of discussions, and it never really forms the main agenda of those discussions. And one of the reasons why this has happened is that it's difficult to measure the productivity of paid childcare, especially for women in the informal economy who remain invisible with regards to the contribution they make to the economy. This means that their needs are not highly prioritized in these discussions. Also, one of the reasons paid childcare is neglected, it's not clear which ministry should be held responsible. And you find that childcare in most cases falls through the cracks. If you think about the health ministry, they are more concerned about the health needs of young children. If you think about education ministry, they are likely to be managing big budgets. And in Kenya, we have free education, and there's so many issues going on around that provision of free education. And you would imagine that the staff or the officials in these ministries would not have time to look at an informal sector like paid childcare. When you think about labor and social protection, they also have issues that they prioritize within that ministry. So because of this, none of these ministries is likely to take on responsibility for regulating, funding, or even supporting the informal childcare sector, which remains highly fragmented. Another reason it's paid childcare is neglected is because it's not considered the business of the state, like ECDE, Early Childhood Development and Education, or primary education. And one of the reasons that could be pushing this situation or this scenario is that paid childcare is also a mix of several options. You find home-based, school-based, church-based, private centers. All these different forms of provisions are poorly policed. There are guidelines where there are guidelines in place, these remain poorly implemented. And in some cases, these guidelines are overly ambitious, and many of these childcare facilities are not able to follow these guidelines. Paid childcare is not considered a necessity, and yet it is part of the infrastructure required to build strong foundations for young children during the early years. And then underlying all these issues is the gendered aspect, where caring for children, and my fellow panelists have already mentioned this, caring for children in many societies has historically been and is still being seen as women's work. Childcare is generally considered to fall under the reproductive sphere rather than the productive sphere, and women are looked at as having a natural inclination towards it. Caring for children is still considered women's work, with Apta has mentioned the men are hardly involved in that sector. And you find that many policymakers and researchers have slipped into this thinking that where they assume that parents, especially mothers, are the only caregivers for young children, and that almost all or almost all the caregiving happen at home. Because of this, the childcare sector remains neglected. As more women enter the workforce, their role as income earners frequently has to be juggled. They have to juggle this with so many other roles, including providing childcare. We see rapid urbanization happening in sub-Saharan African countries, and this neglect of childcare is becoming more pressing. One of the ways we can bring out the issue out of the invisibility is to make the scale of the issue and current quality of childcare provision more visible. We are attempting to do this as APHRC. We are attempting to do this through one of our studies, the Nairobi Early Childcare in Slums study, where we want to look at provision, how much provision there is and how much demand there is. We also need to make the need for childcare more visible. Some of the critical questions we could ask is, where are children spending the majority of time during the day? And wherever children are, who is looking after them? Care also needs to be recognized as part of the economy, because childcare is essential, particularly for women to be able to work. We find that during the COVID-19 pandemic, a lot of women had to leave work, or a lot of women had to change their working situation because of taking over the responsibility of childcare, or childcare responsibilities being left totally to them. If we can bring men somehow into this equation, Apta has already talked about that, this is likely to make a huge difference. We also need more collaborative working among the different players. More women, including the undocumented childcare providers themselves, need to be enjoined in the policy, research, and funding discussions around childcare, so that their voices and ideas are heard. And also, this will help us to design childcare interventions that are impactful and scalable. Research will also be needed to explore how big the market is, the cost effectiveness of the childcare interventions, particularly the short and long-term benefits to different aspects such as child health, well-being, and learning, in addition to the benefits that this provision or the interventions can bring for parents, especially mothers, and for employers and economies, including whether and if improving access to childcare, particularly in slums, can contribute to female economic empowerment. It has become critical to determine what policies, programs, and interventions can best support these young children and those who care for them. So you see that research-informed interventions to improve childcare have the potential to reach some of the most vulnerable children at the most critical time of their lives. Thanks.
Thank you so much, Patricia, for that amazing answer. So the next question I'm going to pose is going to go to all of our speakers. Each of them are going to have 2 minutes to respond, and I'll call on each of you as you go along and as you respond and as the questions are answered. So starting with you, Rula, we've heard a lot about the barriers and challenges for addressing paid and unpaid care in the context that we work. And I think everybody has already spoken to this a bit, but what are some of the examples of the innovative programs, research, and partnerships that your organizations are involved in to tackle these issues? So 2 minutes, starting with you, Rula.
Okay, so I would say in the beginning of the pandemic, the IDWF had to redirect its programming. We are a federation from the labor movement. We don't usually do relief work, but as we are driven by being accountable to our affiliates, and early on within the pandemic, we realized that we would need to redirect our programming towards making these unions sustainable, because workers unionizing is a big part in how we envision investment and care to happen. Like, that's the advocacy that would push it through. So we created the Solidarity Fund. Another thing that we're currently doing is that the IDWF is working with Oxfam and others to develop a global care policy scorecard on unpaid and underpaid care work. And the aim of this scorecard is to provide practical tool to assess and track governmental progress in creating enabling policy environments on care This scorecard framework draws on the work of feminist economists, and it focuses on transformative policies. It has recently been piloted in a few countries, in 4 countries, and we will be publishing the results of this pilot in early September. So this goes to say that as we are accountable to the base, also governments and people who create policies must be accountable to that base as well. Insofar it goes for the base itself, Adriana, my colleague, would speak better to this, but we have seen multiple attempts at creating cooperative models amongst workers, and they have ranged in size and they have ranged in purpose as well. Maybe I would give the floor to Adriana to speak more about this.
Perfect. Go ahead, Adriana.
Muchas gracias, Rula. Bueno, mis 2 minutos. Como decía Rula, la pandemia realmente ha significado volver 3 pasos atrás para muchas de las organizaciones de trabajadoras del hogar. Quisiera recordar que en América Latina existe una normativa de protección que no es perfecta, que no es completa, que no es exhaustiva. Sin embargo, existen algunos marcos legales, comenzando por el reconocimiento y la ratificación de la Convención 189 de Trabajo Decente de Trabajadoras del Hogar. Esto es producto de la movilización y la organización de base intensa de las organizaciones de trabajadoras del hogar. Esto ha dado pie a que se creen leyes de trabajadoras del hogar y normativas y reglamentaciones de trabajadoras del hogar. Sin embargo, la implementación de estos marcos legales es lo que todavía es un unicornio azul para la mayor parte de los países. Durante la pandemia esto se ha vuelto mucho más evidente. Por una parte vemos a los gobiernos municipales y nacionales en reconocer la absoluta importancia del trabajo del cuidado, tanto así que muchos gobiernos han nombrado a las trabajadoras del hogar como trabajadoras esenciales, pero nada más en discurso, porque en la práctica no han sido protegidas, no han tenido un régimen de protección y hasta ahora en un contexto de post-pandemia no están incluidas en las categorías principales para la vacunación, por ejemplo. En este sentido, las compañeras ahora están luchando para que se cumplan 3 aspectos mínimos. Hay muchos más, pero lo mínimo es un salario mínimo que está estipulado en sus leyes nacionales y en la normativa internacional, un contrato por escrito, como cualquier otra ocupación, y la seguridad social. En América Latina tenemos a casi el 80% de las trabajadoras del hogar que no están acogidas a la seguridad social, y esto es un testamento muy fuerte de decir las trabajadoras del hogar todavía no son tomadas en cuenta como un sector valorado en la práctica. En la legislación, sí. Entonces, las trabajadoras del hogar están peleando para hacer esto realidad y para eso necesitamos muchas alianzas, necesitamos la voluntad política de todos los gobiernos, pero todo comienza con la premisa fundamental que nos recordaba Kate al principio, que es decir, el trabajo del hogar, el trabajo doméstico es un elemento fundamental para una recuperación económica centrada desde un punto de vista feminista y de los cuidados. Del dicho al hecho, de la práctica a la teoría hay mucho trecho y quienes están caminando esto son las propias trabajadoras del hogar. Gracias.
Thank you, Adriana.
Gracias, Adriana. Así que ahora le quiero ceder.
You spoke a bit to the State of the World Father Report, but any other thing that you'd like to highlight?
Sure, thank you so much. And yeah, so I mentioned the State of the World's Fathers, which is actually co-coordinated not just by Promundo, but also but through the Men Care campaign, which is a global campaign of over 100 partners in over 55 countries, working together around engaging men and boys and fathers in caregiving and violence prevention for gender equality. So that's so. Promundo engages in those types of networks and collaboratives in order to create kind of a shared international agenda for moving these moving these issues forward. I do want to highlight, in terms of Promundo's programmatic work, one program in particular, our program P. P stands for Pa or Padre in Portuguese, father in Portuguese or Spanish. In Rwanda, we have a program. We've adapted the program alongside the Rwandan Men's Resource Center, ROMREC, called Bandabereho. It's a program that engages fathers and couples around men's engagement in caregiving, maternal, newborn child health, and couples communication. It's on track to be scaled up currently, but on the national level by the Ministry of Health. So it's a deep partnership, not just between Promundo and ROMREC, but also with the National Ministry of Health and local community health workers. The program is started out as a group education program that's been rigorously evaluated and shown that couples that have participated in the program compared to the control group are more likely to see men taking on more care work in the household. We've seen actually approximately an increase of 50 minutes more of care work per day as a result of having participated in the program, as well as improving overall satisfaction compared to the control group, and also a reduction in violence both against women and against children. This is compared to the group that did not receive the intervention. During the pandemic, we actually went back to research to revisit with a lot of the groups and the families that had been participated in the original Bandaberejo program, pilot programming back in 2015, both those who had enrolled in Bandaberejo and the control group, to assess how they were faring as a result of COVID-19. And the study found that both participants and non-participants faced similar challenges during the pandemic, such as financial strain, increased caregiving demands, and related stress. Couples who participated in the program were coping better than participants. The Bandaberejo couples were more likely to report strengthened couple relationships, better communication about household decisions, and less frustration with their partners and children. Women who participated in the program reported less stress and anxiety related to COVID-19, and that their partners were less likely to have used alcohol during the COVID-19 lockdowns compared to non-participating couples. So we see that these programs that are situated within a gender transformative framework, and also that come with the support and the collaboration with government officials and national officials, can really see these positive shifts being maintained over time. I'll stop right there because also it's turning a little bit like it's going to thunder around here, so I don't want to scare you all with any of those sounds.
Thank you, Appa. Patricia, same question for you.
Thanks. So we are currently working with Kidogo, which is a social enterprise that seeks to provide quality childcare in informal settlements. And Kidogo has done a lot of work in Nairobi, in informal settlements in Nairobi. Their program has a wide reach, and they use an innovative hub and spoke model to work with what they call mamapreneurs. So the hubs are like the centers of excellence, where they provide training and support to the spokes. The spokes are daycare facilities that are run by local women who are labeled mamapreneurs, and they're given training and then regular support in the running of their daycare facilities. So we've seen that the Kidogo model has worked very well in Nairobi, and we would like to test the model in another county in Kenya, which is the Nakuru County. In this research piece, we want to see whether a public-private partnership between the county government and private businesses can work in just improving the childcare service provision in Nakuru County, particularly within the informal settlement settings and also within the flower farms. And Kate already mentioned how the private businesses or how the private sector can make a big contribution to just supporting the childcare facilities or childcare service provision. So we want to evaluate what works at scale in the Kidogo program, and then we also want to explore which aspects of the Kidogo program would need to be adapted for the different settings. We want to see the impact of quality childcare provision on women's economic empowerment, and the women that we are going to involve are those that are using the childcare services, as well as the providers of the childcare services themselves. Thanks.
Great. I'm going to jump to our next question in the interest of time, and so that we also have a bit of time for the Q&A afterwards. So again, to all of our speakers,